Has someone close to you started showing subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, but the reality is that the body often sends quiet warnings months, sometimes even a full year, before reaching its final stage. The issue is that most people overlook these signs because they seem insignificant at first. Only later, when looking back, do families realize the clues were there all along. But by then, it's too late to prepare or make the most of the remaining time together. In this video, we'll discuss 5 important signs that often appear roughly a year before an elderly person passes away. Some may be things you've noticed but dismissed as part of the normal aging process, while others might seem minor but actually indicate the body's gradual decline. Recognizing these signs early allows you to provide better care, create meaningful moments, and most importantly, ensure that your loved one's final stage of life is as comfortable, dignified, and peaceful as possible. Stay with us to learn how to recognize these signs early. If you find this helpful, like this video and subscribe for more insights. Now let's begin. Stay with us until the end because these 5 signs can help you prepare both emotionally and practically for what's to come. When you understand what is happening, you won't be caught off guard. Instead, you'll be able to make the most of the time you have left with the people who matter most. Let's begin. One of the earliest and most noticeable indicators that a person may be approaching their final year of life is unintended weight loss. At first, it might not seem like a big deal. A belt needing to be tightened, clothes looking looser, or a once hearty appetite that gradually fades. Many families brush this off as just another part of aging, but the reality is that losing weight without trying is rarely a good sign. It often means the body is no longer efficiently absorbing nutrients, muscle mass is deteriorating, and vital functions are slowing down. Aging naturally leads to some muscle loss, but when it happens too rapidly, it signals a deeper problem. The body may be struggling to digest food, or it might no longer process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement harder, it increases the risk of falls, weakens the immune system, and leaves the person more vulnerable to infections. Another reason for weight loss in the final year of life is a noticeable and often gradual shift in appetite, which is more complex than simply not feeling like eating. Many older adults begin to lose their natural sense of hunger, and the internal cues that once signaled meal times or cravings become much less frequent or disappear altogether. Their sense of taste and smell often diminishes significantly, making food less enjoyable or even unappealing. Meals that were once favorites may now seem bland or tasteless, reducing interest in eating. As a result, they may start skipping meals, eating only a few bites, or choosing to eat much smaller portions. This isn't just a change in preference or habit, it reflects a deeper biological transformation. As the body gradually begins shutting down, it stops sending strong hunger signals to the brain because maintaining regular nutrition is no longer a priority for survival. Consequently, energy levels begin to drop, physical strength fades, and the person may experience a slow but steady overall decline. In addition, various underlying medical conditions can contribute to this decrease in appetite and food intake. Weight loss is a very common symptom of chronic illnesses such as cancer, congestive heart failure, and advanced kidney disease, conditions that often develop or worsen long before more visible signs appear. Furthermore, mental health struggles like depression and neurocognitive issues such as dementia or Alzheimer's can also affect eating habits, leading to an ongoing cycle where the body doesn't receive the fuel it needs to function properly. In response to these changes, many families do their best to help their loved ones regain weight or maintain their nutrition. They may try offering favorite meals more often, preparing soft or easy-to-chew foods, or even turning to nutritional supplements like protein shakes. While these are thoughtful and well-intentioned actions, if weight loss continues despite all these efforts, it's important to accept that the cause might not be related to diet alone. What's happening may be part of the body's natural preparation for its final stage of life. In this context, encouraging someone to eat large meals or pressuring them to maintain a full appetite can actually cause discomfort or stress. Instead, the focus should shift toward comfort. Offering small, easy-to-digest meals, keeping them hydrated, and creating a calm, pressure-free eating environment can make a significant difference in their quality of life. If you begin to notice that an elderly loved one is losing a lot of weight, especially if they are also eating less, becoming noticeably weaker, or no longer have the strength or motivation to stay active, it is a sign that should not be ignored. This situation goes far beyond changes in appearance. It is a message from the body that it is undergoing a deeper transformation. Recognizing these signs early can help you better prepare emotionally and practically, allowing you to support your loved one with compassion and make the most of the time you have left together. One of the most striking and emotionally difficult changes that can occur in the year leading up to the end of life is the presence of overwhelming and persistent fatigue. This is not the kind of tiredness that improves with a good night's sleep or a day of rest. Rather, it's a profound physical exhaustion that affects every part of the body and makes even the simplest of daily tasks feel monumental. Something as basic as getting out of bed in the morning may become a slow, effortful process. Walking a few steps across the room may leave them feeling winded or unsteady. Even engaging in once pleasant and routine activities, like preparing a small meal, dressing independently, or having a conversation with a friend, can become too exhausting to manage. While it's true that aging naturally brings lower energy levels, this level of fatigue goes far beyond what is typically associated with growing older. It is a clear sign that the body is starting to conserve energy for only its most vital functions. Internal organs, such as the heart and lungs, may no longer be functioning as efficiently as they once did. Circulation weakens, muscle strength diminishes, and oxygen doesn't reach cells as effectively, which causes the person to feel increasingly weak and fragile. This shift in energy and stamina is often subtle at first, but grows more noticeable over time, particularly as daily routines become harder to maintain. Another major contributor to this type of fatigue is the overall slowdown of the body's metabolism, which plays a critical role in how energy is produced and distributed. In a healthy, functioning body, the metabolism converts food into usable energy efficiently. But in the final stages of life, the body starts redirecting its limited resources. Energy is no longer allocated for activities or even routine bodily processes. Instead, it is conserved for core survival functions like breathing and maintaining body temperature. This is why people in this stage of life often find themselves sleeping more during the day, needing frequent naps, and having difficulty staying awake for long periods. Their body simply does not have the energy to stay alert. In some cases, this fatigue can appear suddenly. An individual may seem relatively okay one moment and then suddenly crash, becoming lethargic and unresponsive. Perhaps one of the most painful aspects of this process is the emotional toll it takes, especially on those who have always valued their independence. Seniors who once took pride in doing things for themselves may begin to feel embarrassed or frustrated when they realize they can no longer perform basic tasks without help. They may begin to withdraw, not because they're disinterested in others, but because socializing takes more energy than they can spare. This emotional fatigue, combined with physical exhaustion, often leads to isolation, which sadly only worsens the decline. It's crucial for families and caregivers to recognize that this stage isn't laziness or defeat. It's the body doing what it must to conserve energy and survive. Offering patience, understanding, and support, without judgment, can make all the difference during this time. For family members, watching a loved one transition from being active, independent, and fully engaged in life to becoming increasingly exhausted, withdrawn, and dependent can be an incredibly emotional and painful experience. It's common to feel confused or even helpless as you witness someone who once thrived in their daily routines now struggling with the most basic activities. Often, the initial response from family members is to try to encourage their loved one to push through the tiredness, offering words of motivation, suggesting they try to stay busy, or helping them set small goals in the hope that it will reignite their energy. While this comes from a place of care and love, the reality is that during this stage, pushing physical or social engagement may not bring improvement. In fact, it can create unnecessary stress. What's truly important in these moments is acknowledging and respecting their limitations, understanding that rest is not only beneficial but necessary, and doing what you can to ensure that their final days are as peaceful, comfortable, and dignified as possible. If you begin to notice that a loved one is experiencing persistent fatigue that doesn't improve with sleep or periods of rest, this should be taken as a meaningful sign. It's not just tiredness. It is often a signal from the body that it is undergoing a major transition. The best gift you can offer in this phase isn't activity or stimulation, but rather presence. Sit with them. Hold their hand. Have conversations when they're alert and receptive. Create a calm atmosphere filled with patience, gentleness, and warmth. Let go of expectations and simply be with them in the moment. Because when all is said and done, what matters most is not how productive or active they are. It's the feeling of being loved, supported, and not alone in their final chapter. If you've made it this far in the video and are finding these reflections helpful, please comment number 2 below so I know you're here. And if you haven't already subscribed, I kindly encourage you to do so and activate the notification bell so you don't miss any of our future content. Your support allows us to continue creating thoughtful and compassionate resources that can make a real difference in people's lives. Let's continue. As a person approaches the final stage of life, there are often subtle yet unmistakable changes in their cognitive functions, communication abilities, and the way they interact socially. You may begin to observe that someone who was once quick-witted, expressive, and mentally sharp starts to display signs of confusion. They might forget things more frequently, ask the same questions repeatedly, or appear lost in thought even when surrounded by familiar faces and places. Their ability to follow conversations may decline, and they might have trouble finding the right words or lose their train of thought mid-sentence. These shifts can be difficult to watch, especially if the individual previously had no major memory concerns. Yet, these cognitive changes often develop slowly over several months or even up to a year before death, and they are a natural part of the body's overall decline. It's important to remember that the brain, like any other organ, relies on a consistent supply of oxygen and nutrients to function properly. As circulation diminishes and the delivery of oxygen weakens, the brain's ability to maintain mental clarity begins to falter. The individual may begin to experience moments of confusion followed by brief periods of clarity, which can be emotionally jarring for both them and their loved ones. One day they may recognize everyone in the room and carry on a meaningful conversation, and the next they may appear detached or confused about where they are. In some cases, they may fail to recognize people they have known for years or get disoriented even in their own home. These fluctuations can feel like the person is mentally coming and going, and while it can be distressing, it is not unusual. Alongside cognitive decline, many people nearing the end of life also begin to withdraw emotionally. You may notice they no longer initiate conversations, seem less interested in participating in group settings, or spend long stretches of time in silence. This is not necessarily due to sadness or loss of affection. It's a sign that their brain is no longer processing social cues and emotional exchanges in the same way. What once felt natural, talking, laughing, storytelling, may now feel overwhelming or draining. Noisy or busy environments can quickly become too much, and they may seek solitude more often. Emotional and behavioral changes may also become apparent. Some individuals may become irritable or more anxious than usual, reacting sharply to small things. Others might seem eerily calm or emotionally flat, showing indifference toward situations that once would have mattered deeply to them. These are not conscious choices or signs of apathy, but rather reflections of the brain's struggle to keep up as the body slowly shuts down. Emotions become harder to express and manage, which can leave the person seeming distant or unfamiliar. For those who care deeply about them, this stage can be one of the most painful parts of the journey. Watching someone you love slowly disconnect from conversations, memories, or shared experiences can feel like a loss in itself, even before physical death has occurred. But it's crucial to understand that your loved one is not choosing to leave you emotionally. They are not turning away from you on purpose. Instead of trying to bring them back to how they once were, try meeting them where they are now. Speak gently. Offer simple reassurances. Sit with them, even in silence. Even when they seem distant or confused, your presence has meaning. Your love and care are still being felt in ways you may not fully see. If your loved one is becoming more forgetful, increasingly confused, or emotionally distant, do not overlook these changes. They are often the body and mind's way of preparing for the final transition. This is a sacred time to be present, to honor quiet moments, and to create an environment filled with calm, safety, and love. Even when language fails, the heart continues to listen and feel. As the body begins to shut down, one of the clearest physical signs is a weakened immune system. You may notice that a person who rarely got sick before is now catching every cold, flu, or minor infection. Illnesses that once passed quickly now take much longer to recover from, and simple wounds like small cuts or bruises heal at a noticeably slower pace. These changes are not random. They indicate that the body is losing its ability to defend and repair itself as it once did. One of the biggest concerns in this stage is recurrent infections. Conditions such as pneumonia, urinary tract infections, UTI, skin infections, and even oral infections become increasingly common as the immune system weakens. Families often see these as isolated health issues. But when infections become frequent or take an unusually long time to resolve, it is often a sign that the body is struggling to fight back. Even antibiotics, which may have worked effectively in the past, can start to show reduced effectiveness. A person may require stronger medications, extended recovery periods, or multiple rounds of treatment for infections that were once minor. If chronic wounds start appearing, or if small cuts, sores, or bruises take a long time to heal or reopen frequently, it could indicate poor circulation. When blood flow is compromised, oxygen and essential nutrients struggle to reach the skin and tissues efficiently, significantly slowing the healing process. This can be especially concerning for individuals who are less mobile, as they are at a higher risk of developing pressure sores, which, if not managed carefully, can lead to serious infections. What's even more alarming is that infections in the final year of life often do not present in the way people expect. Instead of a high fever or obvious symptoms, an elderly person may simply seem more fatigued, more confused, or less interested in eating. In fact, a sudden decline in mental alertness is often one of the first warning signs of an underlying infection, appearing even before physical symptoms become evident. This is why early recognition of these subtle changes can make a significant difference in the care and comfort they receive during their final stage of life. For families, witnessing a loved one go through repeated infections can be both frustrating and heartbreaking. The instinct is often to seek aggressive medical treatment, hoping that another round of antibiotics or another hospital stay will resolve the issue. However, at a certain point, the focus tends to shift from curing to providing comfort, ensuring that they stay hydrated. Keeping their skin clean and moisturized, and reducing stress on the body can sometimes do more for their overall well-being than further medical interventions that may only prolong suffering without improving quality of life. If you're still watching this video and find these insights valuable, please comment number 4 below to let us know you're here. And if you haven't subscribed yet, I encourage you to do so and enable notifications so you never miss a new video. Your support helps us continue creating informative and inspiring content. Now, let's move on. One of the most telling signs that the body is transitioning into its final stage is a noticeable change in breathing patterns and circulation. You may observe that your loved one's breathing has become slower or shallower than before. At times, they might pause between breaths, or their breathing may become irregular, alternating between speeding up and slowing down unexpectedly. Some individuals develop a pattern known as Cheney-Stokes respiration, where periods of deep, rapid breathing are followed by moments of apnea, pauses in breathing. These shifts can begin subtly but become more pronounced over time. Another indication of the body slowing down is weakened circulation. You might notice that their hands, feet, nose, or ears feel unusually cold to the touch. Their skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body starts prioritizing blood flow to vital organs, reducing circulation to the extremities. It is a clear sign that the heart is not pumping as effectively as before. Shortness of breath can also become more frequent, even with minimal movement. Simply sitting up, speaking, or changing positions may leave them winded or struggling to catch their breath. You may notice them breathing through their mouth more often or pausing mid-sentence due to breathlessness. If they were once able to move around easily but now find it difficult to walk across the room, it may indicate that their lung function is declining. In some cases, fluid buildup in the lungs can make breathing even more difficult. This can result in a persistent cough, a gurgling sound when breathing, or a sensation of tightness in the chest. Many people assume these symptoms are due to congestion from a cold, but in elderly individuals nearing the end of life, they often signal weakening lung capacity. This can make lying flat uncomfortable, leading them to prefer sleeping propped up on pillows or in a recliner to ease their breathing. For family members, these changes can be alarming. The natural reaction is to want to help, encouraging them to take deeper breaths or worrying that something urgent is happening. However, in many cases, these shifts are simply part of the body's natural process of slowing down. While it may not always be possible to reverse these changes, there are ways to ensure greater comfort. Keeping the room cool, using a humidifier, or offering small sips of water can help relieve discomfort. In some situations, medications or oxygen therapy may provide some relief, but at this stage the focus often shifts from fixing the issue to making sure they are as comfortable as possible. If you notice changes in breathing, cold extremities, or a bluish tint to the skin, take it as a sign that the body is conserving energy and circulation is decreasing. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In the final months or weeks, the most meaningful thing you can offer is not medical intervention, but comfort, dignity, and the reassurance that they are not alone. As we reach the conclusion of this video, take a moment to reflect on the key signs we've discussed. Noticeable weight loss, extreme fatigue, cognitive decline, frequent infections, and significant changes in breathing and circulation. These 5 indicators often emerge in the year leading up to an elderly person's passing. They may not all appear simultaneously, and they may not always be immediately obvious, but when they begin to show, they serve as important signals that the body is preparing for its final transition. For many families, accepting these changes is incredibly difficult. The instinct is to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. However, sometimes the most compassionate thing we can do is listen to what their body is telling us. Rather than focusing on reversing what is inevitable, we can shift our attention to ensuring their remaining time is as peaceful, comfortable, and meaningful as possible. Recognizing these signs is not about fearing death, it's about being prepared for it. When you understand what is happening, you can provide better care, make informed decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and making sure they feel valued and supported. If you are noticing these changes in someone close to you, take a deep breath and remind yourself that you are not alone in this journey.